Hi, everybody. It's so nice to see some of you. I saw a few of you at ARSL, and as always, it's nice to come back and talk to my friends at CKLS. So without further ado, I'm going to go ahead and share my screen. Oh, I do want to mention, if you need captioning or if you want captioning, you can click on Show Captions at the bottom, and you should be able to access those. And like Liz said, we will be recording this, so you can always watch it later, and you'll have my contact information in our regional medical libraries information at the end of the presentation. Throughout, we're going to be dropping a few links in, but those will also be provided to you if you need them. So anyway, all right, let's get on with the show here. Okay, so can you see my to weed or not to weed? That is the question.
Yes, ma'am.
All right. Okay. So some of you, I think I know most of you, I'm not sure, but just in case there are a couple people out there, the title of this is to weed or not to weed, and that is the question. And I've been on a number of weeding teams in my past public library life, so it was always a painful thing for some libraries. It was a joyful thing for others. But the topic today is centered around our health information collection. So I hope at the end you're able to take away some pearls of wisdom on how to enhance your collection. All right, so for those of you who don't know who I work with or who we are, the Network of the National Library, or NNLM, is the outreach and engagement arm for the National Library of Medicine. NNLM is composed of 7 regional medical libraries, as well as 7 offices and centers located at health sciences libraries across the country. And what we do is we provide training opportunities, just like this one, funding, and more to a wide variety of member organizations to help support NLM's mission of advancing the progress of medicine and improving the public health. Institutional membership is free, and we identify an institution as small public libraries, big public libraries, academic libraries, community health organizations, etc. So it's free of charge, and joining the network is really easy. So if you want any more information about how to join or how to connect with me, you can visit nnlm.gov or my contact information that will be provided at the end. The reason that's important is I'll get to that at the end, because we, like I mentioned, we offer funding opportunities. So for those of you that don't know, NLM is the world's largest biomedical library, and it has a vast print collection that it maintains. And it also has online resources like Medline Plus, which we're going to talk a bit about today, and PubMed, which is kind of the premier search, free open source searching tool that offers a wide variety of peer-reviewed academic articles on a wide variety of subjects. And it's also one of the 27 institutes and centers located within the National Institutes of Health. You may be more familiar with things like the National Cancer Institute and what have you, the Center on Aging, but we are one of those institutes. And recently, I want to bring to your attention that we launched a really cool thing called the NNLM Discovery Podcast. And check that out, because it talks about the funding that was done across the United States in all different regions recently on some really innovative projects. And these podcasts are available wherever you stream your podcasts, so you can learn more about that on our website as well. So I do encourage you all to visit our website, because there's all kinds of stuff on there that has to do with health information. So take a look at us. All right, so here's the agenda for today. So we are going to talk about how to evaluate your collection. And a collection, when it comes to mind, it might be what you think of on the shelf, but we're going to learn it's a lot broader than that. And how to know your community. You know, that's really probably a really important facet of how you build any kind of collection, but especially health information collection. And then, so we're going to talk a little bit about materials that never age and what you can actually put on the shelf, so that you don't have to worry about having to weed. And we'll cover some free, reliable health information resources. And then I want to talk a little bit about how to think outside of the box, or ways to make an impact on your community that can be done with a little bit of effort, but I think a lot of payback in the end. And I'll talk a little bit about funding for some health information resources. All right, so we're going to do a little activity, and this is a chat thing. So, I want you to really think about this and think broadly. Don't just think about books. So what is the condition of the health and wellness collection at your library? And you can put that in the chat, but if you say, I don't know, that's really an honest answer. And I think that's a good answer. So, let me know what the condition. It could be great shape. I just took care of it. Pretty skinny. There's not much to it. I don't really know what to put in it. So let me see those messages in the chat. Oh, you're okay. Life support, perfectly appropriate. We're going to talk about how to revive it. I am a nurse, for all those of you that don't know. Oh, come on. We have to have one. Oh, hodgepodge. All right. We read it, but yep. Okay. Well, we're going to talk about that. Mary Jo, I have no clue. Well, I'm going to help you. And Mary Beth, yes, we're going to talk about what to do when you have a sparse, tiny budget that's non-existent. So yeah, thanks for this. This is, these are all really great answers. All right, good. Otherwise, I was going to say it's over if y'all had great collections. Okay, so public library collections that address all of the health-related needs and interests from which libraries and patrons draw information in response to questions about disease, wellness, conditions, prescriptions, non-prescription drugs, therapies. This is what your collection should or could entail. Your collection can also include a lot of physical items, and this could be reference resources. So think of dictionaries or encyclopedias, circulating materials like DVDs and other things. And when I talk about things, that what might come to mind would be maybe you might check out a scale. Somebody needs a bathroom, a scale to weigh themselves on, or you might check out blood pressure cuffs. So those are the things. So what is important to keep in mind is that there's many, many materials that can circulate within your library to address health and wellness topics that are classified under a wide variety of subjects as well. So let's think about subjects with health, subject areas with health and wellness components. And that can include things like applied and domestic sciences, public health, maybe sports, or even arts, the arts in some instances, and more. So additionally, your library's health collection will contain, I hope, electronic items. And so these can be both accessed through free web-based resources, as well as paid databases such as the State Library of Kansas. It has really wonderful paid databases that your patrons with a Kansas State Library card can access.
We have a question in chat.
Sure.
Mary Jo says that I'm an elementary school librarian. Should I be involved in this discussion? She's also an art teacher.
Yeah, I do think so. Quick, because I am going to talk. Well, okay. Now let me qualify this. School libraries are a little bit different in what you have to put on the shelf, but I do think it's a responsible school would have some things in their collection that kids could access. And, you could work with your administration on how to build that collection. Plus, there's a lot of online resources as well that kids can look at as too. So, you can stay if you like, but if you need to go, I certainly understand. So, okay. All right, so let's talk just a little bit about the things that influence your collection management. And this might be something for you to that might affect you too, Mary Jo. So the image on this slide, and some people may have seen something like this, but it talks about the various elements that impact collection management. And I'm just going to talk real briefly about these because I do think they all have really important. They're all important facets to this whole procedure. And it's not just health collections at one thing, but I think you can apply these to all of them, all of your collections. So your library should have a collection policy, number one, and it should have a procedure too, which will of course influence your collection management. So that's kind of this cycle. So perhaps as a policy decision, you're going to adopt a standard age for health materials beyond which they should be removed from the shelf. So just as a for instance, so that's a good thing that you would put in kind of below your overall collection development policy. So first of all, let's talk about community needs. So your community might have a large population of older adults, and the community may need to focus on how to support them. Your existing collection. So perhaps your current collection is really out of date, and it includes some inaccurate information, and it also takes up a huge chunk of space on your shelf. And so the other thing too then would be, what are the gaps in your current collection? I mean, maybe you have a lot of really old 20-year-old books about the craze of exercise 20 years ago, but you're missing some really good cookbooks that could help people that need help with a diabetic diet or a heart healthy diet. Also, think about your library goals and objectives. So a collection management plan will fit into your overall goals and objectives. And that can also include the long-term goals that your library has created. And public demand. All right, so patrons might come in and they ask for things that are specific about a certain health information topic. And so that could influence your decision. And also changes in the environment. So perhaps your library is all of a sudden seeing fewer people visiting the building in person, but they're actually accessing materials online quite a bit. Or maybe you have fallen victim to a budget cut, and you're also wondering how you're going to fill the gap for your patrons that are still wanting materials. So the health collection is different from a lot of collections in that it covers so many topics and that information changes really frequently. So something that you should be aware of when we talk about the health, about the weeding, the health and the health collection and the medical collection, is that the American Medical Association has a say in this. I mean, they've talked about this, and they recommend that materials that are older than 3 to 5 years should be removed from circulation. And this is because, and we've seen this, we saw this with, think about the pandemic, how quickly things turned over and how things changed for almost daily. So because of the advances that are being made in medicine and treatments and research, it makes information go out of date. And so I just want to preface that with some of this, because this isn't me making up this number or ALA making up this number. This is the people that are, and I kind of think are pretty well, should consider them experts in the field. So this is a slide that shows a cyclic image, but I want you to be sure to note that this doesn't mean that it goes in any certain order. So maybe you decide that this year you're going to review your policies and procedures. Next year is going to be a collection evaluation. And then you're going to concentrate on knowing your community. So when you go to add resources, you're all set and you know what you need to do. So just, just remember that each of these steps can be touched on. We're going to talk about these as we move along in the presentation. But I want you to understand, these are kind of fluid and they can change depending on the situation in your library. So we're going to talk again about knowing your community, maybe if there's some community outreach being done, public demand for materials, etc. So, and we will certainly get to that all important topic of weeding. So here is a collection development policy, and I kind of alluded to this, and I'm sure all of you guys have one of these because I know the CKLS people quite well, and it is really important to them that you have one of these, especially in this climate that's going on right now about, a lot of, challenges and what have you. So this policy, one of the, so as you look at your policy, you're going to look at it, and here's just a real simple one that I pulled, and I looked around in the system and I couldn't put my hands on one on a website, but I found Wamigos, and they're very much like most of the CKLS libraries that I'm familiar with in the population size and the people that live in your community. So this is kind of just it talks about the principles that guide the development and maintenance of their collection. And important to point out to your staff is it's set by your board or the governing body, and it's not something that people can just go in and change it at anytime they want to. And however, it's the policy is not going to give specific subject guidance, which is nice because every subject and every topic that we have and every bit of materials that we have in our libraries are all different, so what you do in the 610s, you're not necessarily going to do in your adult fiction or nonfiction. So it's one thing that I want you to think about too is maybe when you're looking at your policy, it might be really useful at this time, like, oh, okay, we have the opportunity then, we're going to take some time to put a subsection in our policy about the health collection, and we're going to talk about maybe the time limit or the type of materials that we're going to concentrate on. So always go back to your policy. And then when I talk a little bit about procedures, I always, library collection procedures, you can't do it by the book. I mean, it's much more tactical. And we talked about this. It's you've got to think about your budget and what are your acquisition priorities. If I live in a community where my adult fiction is much more important, then I'm not going to spend a lot of money on health information products. So, or those resources. And library staff can influence these procedures too, because the front end people, they know what people are coming in and wanting. So a collection procedure would include, guidance for how the acquisitions are made, a criteria for your weeding. And I talked about that. So the selection and deselection. So for instance, 3 to 5 years for the health information, with the exception of certain things that we'll talk about later. And a collection procedure can also cover the roles of electronic versus physical resources, especially as they pertain to meeting the health information needs. And these written guidelines should also be, they should also provide you with reinforcement for any questions or disputes that people have about specific acquisitions or reading decisions. We know people always, how can you throw those books away? Well, I would much rather throw books away then leave them on the shelf if they provide dangerous information. So, think about it in terms of that. So if your library does not have an existing written collection procedure with specifics that guide your health information, this is a good time to think about it and participate in how it's created. All right, knowing your community. So I really think this is probably the most important part of informing your decision on what to include in this collection. And it's probably the most often skipped step. So who are the people in the community and what are their biggest health concerns? What is, your neighbors, the problems that people are having. So think about that. And are there environmental issues that have an impact on the people in your area? So last week, 2 weeks ago, I was in Nebraska, and they have a huge problem with lead issues and their water quality. So, those are some environmental impact issues that affect communities all across Nebraska. And what about people that they're not coming into your library? So think about those people and the support that they need. So, for instance, I'm talking about you could go out and find them in outreach, but I'm kind of thinking more of the people that might be accessing your collection online. So maybe some of your budget or some of your things you could spend on your Sunflower e-library. And then what checks out the most? That's an easy one. We can all run those great Pathfinder reports about what's circulating most. Or maybe somebody comes in, or you've had this people come in, they ask you a specific reference question. So all of these things are things to think about. And I do want to encourage you as librarians, you're not the expert on health information. I mean, we know that none of us are. And I know that health literacy is a real problem. I mean, health literacy, meaning I don't care how much education you have, people struggle with it. But I think what it's really important is to know that there are things out there that you can refer people to. You're not going to be giving medical advice, but you're going to know that when you point them to these resources, they are getting some really great advice, and it's been vetted and it's trusted. And I think that's just the whole point, because we know, people are so isolated that they just can't go out into big cities or where have you. We've got to rely on what we have in our rural communities. And I know the libraries are where people go quite a bit. All right, so what do you already know about the unique needs of your community for health information services? Maybe you live in a community that's, I don't know, 30 miles from the nearest health center. So they might need some access they've been to the doctor and they come back to the community, but they want to find out more about a recent diagnosis. And what needs and wants would you like to better understand? So like if maybe somebody they talk to you about something or a service they'd like to see launched, how can you learn more? So do people, like for instance, do people need blood pressure monitors? Is that something they come in and ask for and you don't have? So maybe that's something that, is a need that you might want to explore. So how do we do that? Well, there's a couple really good resources out there to get health statistics for your community. And I think there's been dropped into the chat, but the County Health Rankings and Roadmaps is a really great site. You can find out all kinds of things about your community. Just if you want to take a look about the health needs of I think it does it by county, it can do it by city, zip code. And the Rural Health Data Explorer is also a really good resource to use. And these are the top two that I think for rural communities are most effective and easy for you to use and can be done quickly. Just nice to keep those around and even on your desktop, just so you can kind of keep on top of what's happening in your community. You can also contact your local healthcare providers in the area. So for instance, health department or the county health department, or if you live in a community that's so small, there isn't anybody there. I know, close by there might be, like for instance, I'll just pick on Rooks County because I'm going to talk about them later. But, for Palco, that's probably the closest. So, talk to those people at Rooks County and find out, what issues they're seeing. And the other thing that this is going to do is it's going to help start to build a relationship. They're going to know that the libraries are out there and, people are going there and they need health information. So could be a potential partnership. Look at, talk to nonprofits, senior centers, what have you. They're gonna help you target this, and talk to your patrons. You don't have to have a formal discussion, but we all know we talk to our patrons. We know that so and so's got this diagnosis, or they're not feeling well, or what have you. And those, just tune into that. And this is kind of a long shot. Community outreach to those not coming to the library. That's a little bit tough to do for so many of you that are single people libraries, but even just asking the churches or places in your community to put up a flyer about something, like things that you have available, might just help connect your community to you as a resource for their needs. All right, so why do we weed? Why do we need to do this? Maybe it really, why do we care? Well, we care because of a lot of things. Careful and rigorous weeding of this collection, it's really critical to maintain this, because for a couple things, it's your patrons are going to count on you to give them really important information that for decisions that, and to inform decisions in their lives that affect their health and well-being. So in general, you want to evaluate those health collection materials to make sure it doesn't really matter the format. So I'm talking just whatever, print, you name it. Make sure they're science-based and accurate and come from really authoritative sources. And I know there's a lot of things out there from people that have, they publish books and things about whatever the topic is, but they really don't have much research basis, or they don't really base it on fact. I would probably stay away from those just for a couple of reasons. You can get, if you really think that, if you feel really strongly about having your patrons being able to access that, I would spend the money on it. I would ILL it. So, Use ILL, it's your friend, because you're going to be able to find it somewhere. And you want things to be current in both fact and appearance, especially the appearance. I really think that's important in your youth collection, because, who wants to check out an old ratty looking book? I mean, there's better condition speaks loudly for the way things circulate. And you want to make sure that you have things that are appropriate for your community in terms of language and age. So if you do have Spanish speaking people, or if there's another language that's spoken in your community, make sure that you're sensitive to that. And I'm going to show you some things too, some sources or online resources that have multilingual things that are available. And you want to make sure that it's accessible both individually and in multiple formats. So you want to make sure that, if you have low vision users that come into your library, make sure you have a screen cover that helps them to be able to see that. Or maybe, I know Kathy Ron's not here, but she could help you too with the collection that she deals with. So, and safety, old medical advice can be really, really dangerous. So let's just make sure that we're not putting it out there for people. And I think that weeding health materials ruthlessly is a good motto to live by. You can go on and run a circulation report of your section, and you're probably going to find out that a lot of this stuff doesn't circulate anyway. So you want to closely evaluate your print material that's more than 3 to 5 years old. So you just look at it. Is it circulating? No. If it's not, you have my permission to remove it. Outdated materials, you really need to promptly discard them. You just need to find a place to recycle or get rid of them. You don't want to regift weeded health materials. You just don't. It's just not a good idea. If you're taking them off your shelf, they shouldn't be in somebody else's library. And you want to evaluate works on diet and exercise the same way you would for the health materials, because, to have a book on the shelf from a diet craze that was 20 years old, probably not a good idea. There's much newer advice out there. And again, I don't think you need to spend money on that. There's so much of it's available online. And if somebody does want a copy of a book, you could probably find that on ILL. And don't hold on to an outdated print material just because it's expensive. I mean, I know it's hard to let go of some of those things, but it's just not a good idea. I'm going to talk a little bit about a book that I saw a lot when I was in those small libraries in CKLS, is the Physician's Desk Reference. They hand that out because it's got a lot of advertising in it, and I think it's fine, but they give you one every year. So I would suggest you just keep the current year if you're still getting one, or the previous year. You can have one that you use for reference and one that circulates. And this is true for other prescription and over-the-counter drug directories. You can replace them when new editions become available, but don't keep drug guides that are more than 3 years old regardless. And I am going to point you to an online resource about prescription and non-prescription drugs later on. All right, so evergreen books and what to include. Well, here's a list of books that you can retain or purchase if your collection of those in your collection are in bad shape. These books don't age and the content doesn't change. And I would consider, though, if you need a multilingual materials, add those as well. So first of all, they're medical dictionaries. The Dorfland has a really good one, and I know there are medical dictionaries that are in Spanish as well. I think maybe depending on the size of your community, one of these is good, 2 at the most. Anatomy books, Gray's Anatomy. Get one, put it on your shelf, and you never have to replace it because it's the gold standard for anatomy books. Medical terminology, there's quite a few of them out there. Just find one that seems to be in good shape, that your users would find easy to read. Again, that terminology doesn't change. Have a basic physiology book on the shelf. Again, basic physiology or basic biology, those topics don't change. You can have a first aid book. I've been a nurse and I can't remember that first aid has changed much. We still do things the same way that we did I won't tell you how many years ago it was that I graduated, but a first aid book is really good to have, especially if you have kids that are coming in, maybe they're in scouts and they're trying to work on a merit badge. That might be a good thing to have, not only in the adult collection, but in your kids collection. You might want to include current state health codes. If you have people that are interested in that information. And I mentioned cookbooks earlier. I think this is always a good place to invest in healthy eating cookbooks. The American Heart Association has recommended resources. The Diabetes Association also. So there's those kind of things I would think would be quite a really good asset to your health collection. And the youth collection. We can't forget the kids and young adults. Because we have to address their concerns that they have while growing up, and being mindful that they are part of your community and need resources as well. So really well-reviewed books about the human body and puberty would be good to include. I know there's a lot of other topics, the LGBTQ plus topics. I'm not going to get down that road, but I think that if you have kids in your community that you maybe think would benefit from those, but don't be afraid to put those on the shelf, and back it up with your policy. It's really important to make those available because, living in rural Kansas, it's hard, and we need to make sure we look out for them too. Oh, infant and childhood health books are great to include, but again, be mindful of some of those. I don't know if I'd put Dr. Spock on the shelf. Maybe, but anyway, nothing more than 5 years old. Okay, so I know Mary Beth mentioned that library budgets for books and materials are slim. So I want to really encourage you to make a big mind shift to making the core of the library's health information collection available online. As online authoritative and constantly updated databases become more freely available, they're open to all users, and public libraries should really take advantage of this and making them the core of your medical reference collection. I know all of you have computers in your library, so you could easily add some things that in the toolbar that could point people, or a drop-down box if you have a website, because print resources can become out of date so quickly, and they're often out of the scope of your community for relevance. Anyway, so and selected databases. So many of them are free and typically supply the information in a range of languages, which I mentioned earlier. There's multimodality information that's on some of these websites, and it makes it more accessible. So if you have someone that, I think they're really, really important to include, and also libraries should also kind of question, is it worth making a costly print investment in this day and age? Especially when we just sometimes, that book comes off it comes off the print, it comes out of print and it's behind already. It's old. So, and I know a lot of you are really mindful of that. So, and, think about it. You don't have to have shelf space for these online collections, and really leave the work and the heavy lifting to the people that make it their job to keep these resources up and current. So if there's any staff that you have that might be hesitant about using computers or online resources, we have so many free online teaching tools about Medline Plus and consumer health information. Certainly contact me and I can help you point your staff to some things that might make them more comfortable. There we have a link for a public online health collection, and that has so many free resources. And I'm going to talk about a few of them, but I don't want to have time to talk about all of them. But anyway, just take advantage of using those. This resource list, it's free and it's frequently updated, and it does rely on evidence-based science, the places that the links that are on this list. But, you always can't be complacent. You always have to reevaluate what you're providing for your community and, at least every 6 months or, it's like a link checker for a website, how often do you do that? So just make it part of your, every 6-9 month maintenance of your website, or the links on the desktop of your computer if you have a Facebook, if you're just using Facebook. Okay, so here are a few of the federally funded consumer health resources that that you can use. And first one I'm going to talk about, this is our gold star, Medline Plus. So I don't know how many of you have heard of it or even used it for yourself, but it's wonderful. And since I started with the network in 2019, they've rolled a lot of resources that were standalones into this one. It's a one-stop shopping spot for people. So it is, this guide is created and it's maintained by the National Library of Medicine. So any patron that you have that comes in and asks a question about a condition or, wants to learn more about a diagnosis or any general medical reference question, I would direct them here first. It addresses so many needs of a wide range of users. Even clinicians use Medline Plus quite a bit. There's health information that they have is printed in clear language for the average user. Some of it's at maybe a 4th grade level, and mind you, there is some that's higher, but they try to make it user friendly. Medline Plus also has a fully developed area related to drugs and including over the counter and prescriptions, as well as herbs and supplements. And you can see that at the top going across the toolbar. You can search by health topic. You can type it into the search box. It's really easy to use, and it's free and it's authoritative. And it's also, what's really cool is it's available in Spanish. You can toggle between Spanish and English by clicking Espanol up there. And if I have time, I'll give you a tour of this. But I recently attended a presentation from the people at NNLM that translate this. And while it's not fully translated as the English site, they're working on it. I mean, but they take a lot of time and they take into consideration the different dialects of Spanish that people speak. So you can be sure that if you're directing your Spanish-speaking patrons to this, that they're getting quality information. You didn't have to worry about the translation. And when we talk about translation, I do want to caution you about Google Translate. While it's pretty good in Spanish, it's not very good for a lot of other things. And if you don't know what you're translating, you don't know how it's translating, I would never, I would probably stay away from going to a website and choosing Google Translate for a different language and giving it to someone. Because if you don't know the translation, it can be a problem. And I have an article about that. So it was, the article was on discharge instructions, how it's pretty good with Spanish, but it's pretty bad with a lot of other languages. So just be careful with Google Translate. So here's a couple of other resources that I really do like. My Health Finder is one that is a service of the Office of Disease Prevention and Health Promotion. So this site has information for families on a variety of topics, including how to talk to your doctor, healthy living. There's a whole drop down on pregnancy, and it's also available in Spanish. So I was looking at it the other day, and it's more about, prevention. But it's just really interesting. Like if you go to their landing page and you type in your age, the age and sex of a person, it tells you like all the health tests that they should consider having at that age. So the National Library of Medicine also has a really cool thing called DailyMed. And DailyMed is a searchable database, and it provides like the most recent labeling submitted to the Food and Drug Administration by companies and currently in use labeling. So DailyMed contains labeling for not only prescription and non-prescription drugs for humans, but also for animals and animal use. And it also has additional products like medical devices, anesthesia gases, cosmetics, supplements, and medical foods. And then NNLM provides DailyMed to the public, and it does not accept any advertisements. And that's true of Medline Plus. I mean, it's not, there's no advertising. So the reason that's important is you're not going to have bias when you have this information given to you. And Daily Med is typically been reformatted to make reading easy. So, you know, people sometimes go to WebMD, and that's fine, but just be mindful of the fact that it has advertising, and advertising then can kind of lead to some bias. All right, so I talked a little earlier about thinking outside the collection box. So, you know, sometimes, you know, sometimes maybe the reality is people aren't coming in and asking for a lot of health information resources like we talked about. But at the same token, you really want to have some things that support your community's health and well-being. So why not think about doing a project? And some of the things that people that I've encountered in my work with the network are talking with librarians who have done some really cool make and take project kits for people. So basically, you get the materials, you create, like you estimate how many you need, you advertise it, and people come in and just pick up one of these collections, and they don't have to bring it back. And what that does is that your staff doesn't have to worry about checking it in, make sure it's all there, cleaning it, etc. So one of the ideas is an activity kit for seniors. And this idea was born from people that do physical therapy or occupational therapy with seniors. So you can take so for instance, you know, you might make a get moving kit for seniors. So to help them stay mobile and flexible. So you could include a TheraBand, you know, that stretchy stuff that you might see, tie a knot in it, put that in there. You might include a list of exercises that they can do with this, you know, chair exercises or what have you. You can also get maybe a stress ball to help them keep their hands active. Maybe some other just graphics of different exercises that they can do to be flexible. And the way that you do this is like you can buy the TheraBand, comes in really big boxes, and you just cut off a large piece of it, you cut it, you tie it, you put it in a cute little bag, you throw in your resources, and they come in and you give it to them, and you're done. And, you know, you could get medium. That's one, like everybody can use medium, I think, you know, but think about the group that you're dealing with. You could take them to the senior center and just hand them out as a goodwill gesture. A mental health kit would be really good. Winter's coming on and people don't get out so much. So, you know, look into some maybe cross-stitching kits or rock painting kits, or maybe you want to throw in a small puzzle, you know, and some information on how to stay mentally fit during the winter. Brain health kits and information. So for instance, again, puzzles are good for that, or crossword pages, or maybe even a crossword book, or maybe Sudoku. Information about brain health and Alzheimer's and those kind of things. And you can all find all these information things on Medline Plus. That's an idea. Another one was kits for families. So if you have families in your community, this is really one of my favorites. So what do you do when your kid gets sick? So get a bag, put in a digital thermometer, a med spoon, you know, and instructions on how to use it, a medication spoon, maybe some hand sanitizers and stickers for the kids, you know, throw in some contact information for the health department or the local health clinic, and put in some information about the basic things to do when, if your child has some illness. For seniors, I really like this one. Get pill organizers, a pill splitter, maybe even a timer, and include a packet of health information about taking meds properly. So you're probably going, well, this is really great, but how am I going to pay for it? Well, we have funding available. We're one, and I know in your region there are funds available from, you know, different places. So I know the money's out there. But the thing I like about these take and make kits, it's just such a good way to spread some goodwill, and you don't have to maintain a collection. And, you know, it really does promote the well-being for your community, and it gives an awareness of the library and the good work that you're doing, you know, to help people, especially during cold and flu season or what have you. So we have our grants opened on November 1st. We have funding available for express outreach. It's up to $8,000. You don't have to spend all of it. You can put, and I'll show you an example of somebody that we funded that didn't use all the money. We have one that goes up to $25,000. And if you don't think you're have the bandwidth to do this year, think about it next year. Come up with an idea, get a hold of me. We'll talk about it, and we'll see if we can do something to help your community, because I kind of think this stuff is also part of the collection. I kind of think it's an offshoot. Okay, so here's an example of a project we funded. Now, while this isn't a take and make, it's one that the first year I was with the network, with my new network that I was the grant liaison for. And so I was contacted by the people in Rooks County, and they did a project called Raising Awareness of Preventable Respiratory Diseases. And what they wanted to do, I think it was Plainville told Rooks County about our grants, and they wanted to bring in this thing called the mega lungs. And I don't know if you've ever heard of them or seen them, but they're big, giant blow up parts of the body. And this one happened to be important to them because they have a big teen vaping problem in their county. So what they asked for was $5,000 because they had a lot of community partners that they worked with that gave funding for this event. And we paid for just the shipping of the blow up example, but it had the look of what COVID does to the lungs, what vaping does, what environmental things like fertilizers or aerosolized problems of how they affect lung health, as well as smoking. And so that project, I think they had it for 2 days, and they went to the schools, and they had it, I think they had it at a football or a basketball game, and over 926 people got to tour that. So that was really cool because, people out there don't get to see things like that. The kids really loved it. And the impact statement that we got from them was pretty cool. So, and we're really willing to help make your dreams come true when it comes to trying to fund some projects. All right, so I've kind of come to the end of what I have to share. So I don't know if anybody has any questions or if there's anything you want me to tour in the last few minutes. But I've enjoyed telling you, talking about all this. It's kind of what I like to do, and it's always great when people get to make some projects become a reality that help their communities with their health and well-being. So.
Thank you, Margie.
You're welcome.
I also love the kit ideas. Miss Patty was saying that funding support might also come from local service organizations as well. I went ahead and dropped a link to the NNLM page, and we're part of Region 3. And so that actually has some information on funding or sponsorships and stuff like that for you guys to check out. Does anyone have any questions?
Let me ask a question. Oh, you need to unmute. Hang on a minute. I'll unmute you. Oh, okay.
So I got a private question. So something like using Medline. The question was, am I going to remain anonymous?
Oh yeah, Medline Plus. Oh, absolutely. Medline Plus is just, you bring up the website. In fact, they don't have an app right now, but you go onto the website yourself and just tour around and look up what you want. And yeah, we don't track your usage. At least I don't. But it's a great place to find things. And I also teach a lot of classes on Wikipedia, and that Wikipedia comes to the top a lot. Like we teach a lot about it and how to do editing, because Google will force people there. I mean, they force you to Wikipedia. So I would like people now. It's okay. I mean, I'm not I like Wikipedia is okay, but as long as it's you know what you're reading and you know how to spot the bad stuff. But this is such a good resource. Like I know a lot of you have websites, if you could add a health information tab with just a few of these links, and then maybe put out a blast to your community, or, it's going to save you so much money. Oh, good. Yeah. Amy.
Oh, good.
Yep. You can sign up there. You just, go in and sign up, and that makes you available. You can get our funding through that. And the reason is they like to keep track of our zip codes and see how our reach is being measured in terms of our members. But, I just, when I was working in the system, that was in 19, and from 19 to 23, the health information resources have just really gotten much better. But I do want you to make sure that you go to those federally funded ones. There's so many good ones out there. I could talk all day about them. I mean, there's just some really cool things. And, as far as for people in education, I did taught some STEM teachers this summer about, we have a medical collection, the NNLM loans at History of Medicine collection. And, it's just, there's so many really cool things out there that you just don't have to buy. And it changes so often. And, if people have a reference question and you're uncomfortable with it, then you could probably feel pretty good about just going over there and say, well, I don't know. Let's explore this together, and going to Medline Plus. And one of the features it has is some of the things that they have. And let's see. I can just, got a few minutes left. Share that. Let's see here.
We have another question. What advice do you have about connecting people to support groups?
Oh, well, that would be something that I think it should be local, and work within your community. Reach out to your hospitals. Like, for instance, I'm going to use, I'll use like Smith Center has a great hospital. Get a hold of them to see if they have any connections, or your health departments, or even you can search the particular support group that you're needing. And a lot of them may have links throughout the state to groups that you can connect with. I probably would stick with ones that are more, just do your due diligence on who it is that you're connecting with. You want to make sure that it's a safe group. It's somebody that's going to give you good support. So, that's just me speaking personally. I don't have a very good answer on that one, but they're out there. You can just find them. Mental health, there's a lot of mental health support groups right now that help people with grief counseling, with addiction support, et cetera. Just make sure that you're kind of going to a site that you feel like you trust. I hope that helps. If not, email me and I'll see if I can help you. So let's see, just have just a few minutes. I can show you Medline Plus. Let me make it a little bigger here. Can you see that?
Yep.
Pretty well. Okay, so just a quick tour. Like I mentioned, there's a couple of ways to search this. I'm going to slowly scroll down. You can see that across the top, there's your toolbar. It has the same things that are the same things up there, with the exception of the healthy recipes is located down here. So you can search in a couple of ways, either like I mentioned, health topic, for instance. Here you can put it into the search box located up at the top. They always have a featured topic. That's kind of cool. I think that they work hard to change that up. Across the bottom, you've got easy to read health information. There's health information in multiple languages. Here's Medline Plus Connect. So if you wonder what that is, that's more for hospitals or clinics that use electronic health records. Here's a link to our magazine and the information about clinical trials. So let's go ahead and just, this happens to be my favorite part, the drugs and supplements, but we're going to pick a health topic. So let's go up here, and you can either look alphabetically, or you can search by system. So, or location. So here's body location system. Here's disorders, health and wellness. It goes into diagnosis and therapy. So I'm going to go ahead and we're going to pick, let's go to the endocrine system and we'll see what we can see here. Okay, so here it gives you a really cool visual of the human body, like what they identify as the endocrine system. And let's go down here and look up a topic. Let's pick on diabetes because it's such a problem in our country. All right, so we click on it and it takes you right here on this page. It's a nice snapshot. You can, scroll down and you read the summary, start here. So everything that's listed here is going to be found below. Love the medical encyclopedia. It's just terrific. It's really great. You can do show more. Here's some other related health topics. So if you really want to know about an A1C, or let's say you want that diabetic diet, you can click on here. And diagnosis and tests. Here you'll also see what other language that they have it available in. And a lot of these are Spanish, but there's also a place at the bottom where you can search by other languages. And you'll see some of these other groups listed in parentheses. So if I click on diabetes and digestion, it's going to link me out to the American Heart Association, and which is kind of fun. It takes you get out and see what other people, or what other groups are talking about in terms of that problem. Just a quick look. If you, like I mentioned, you can toggle back and forth from Espanol to English. And so for those of you that work with communities, or maybe you have friends or family members that English is their second language and they're more comfortable with Spanish, this is something that's would be really helpful for them. So.
And I like this so much better than WebMD because, like you said, with all of the ads that you get, when they buy an ad space, sometimes they get a say in what content is put on the page. And so that's why it makes it not very reliable.
I mean, there are some really good ones, like Mayo Clinic has a good site, some of those, but I would probably tend to not do the WebMDs or what have you. One of the other sites that I didn't look at, but I didn't talk with you about, but there's also a national, so in the drugs and supplements, it will link
Angel.
I know that there's that links out to the National Center for Complementary and Integrative Health, and it talks about every supplement out there, what the research that's been done, what they know about it, if you can trust it. So it's another really good feature, and this will link you out to it too. So
very cool.
Yeah. Well, in the interest of time, we've got about 3 minutes left. I don't want to keep people, but let's see.
Angel says lots of good info. Thank you. FYI, love the glasses.
Well, those are my reading glasses. So gotta have glass. Everybody knows me. I always have wild glasses. So if any time you need any help, or you want me to talk to your staff or whatever, just let me know. I'm happy to do that. Or if you think of a project you'd like to have funded. Oh, the other thing we offer funding for is we have for professional development. So if you have a meeting that you want to go that has something about health, like I know there's rural health council meetings, or there's, like, I don't know, but if we offer funding for that year round, we also have virtual funding for if you want to attend something that's online. So, and we really want to give that money away. So, we got it. So let's use it. Otherwise we have to give it back, and we don't like giving it back.
Let's not leave money on the table. That would be, let's not do that.
Yeah.
Thank you so much for joining us. And sorry everybody for the happenstance of having to change rooms at the last minute. Thank you, Margie, for being so understanding.
Sure. And I'll send you a link to the recording.
Okay.
Since I'll have it, I'll process it, and I've got all that. So I can send you the chat too. So again, it's my pleasure. I think I'm going to talk to you again later, but I don't know about what. So
all right.
I don't know. Anyway, happy Thanksgiving, everybody.
Happy Thanksgiving, Margie.
Bye.
Before everybody goes, we are going to have a end of year report Tuesday with CKLS on December 19th at 1:30. Thank you so much, Margie. I'm going to stop the recording now.